Humboldt Park in Chicago is a predominantly Latino and African American community. It has been severely impacted by COVID-19. Infection rates among Latinos in Chicago are triple that of white residents and double the rate of African Americans.
I think we have done more than 13,000 tests here since we began this project. And the positivity rate is about 34% compared to statewide in the state of Illinois is in the range of somewhere between 10 and 12.
The high prevalence of the virus in Humboldt Park has in turn had a severe impact on resources at the community's Norwegian American hospital, with COVID-19 patients overwhelming its intensive care unit.
We routinely end up having overflow of ICU level patients in other areas. For example, our ER is holding ICU level patients. Secondly, we also know that the death rate or the risk of dying or having a severe illness is significantly higher in ethnic minorities.
There is now hope the pandemic could soon come to an end, with recently approved vaccines already being administered, starting with frontline healthcare workers.
Each day at this hospital there are long lines of cars waiting for its in-house testing site to open. Although the vaccine has the potential to bring an end to the pandemic, for now there's still major hurdles to navigate.
Even when the vaccines become more widely available, a recent survey found that Black and Latinos show a reluctance to take them.
We know that there's a history of unethical research done in Black, Latino, and Indigenous communities. There's a good reason why Black, Latino, and Indigenous communities may be hesitant to be vaccinated.
Dr. MARINA RIOS is the Director of Social Emergency Medicine at the University of Illinois Hospital in Chicago. She is also a vaccine ambassador and became the first person to receive a COVID-19 vaccine in the state of Illinois. She says authorities must now work to get people to trust vaccines. Del Rios also feels the focus needs to be on public health and not on trying to discover undocumented migrants.
You know, they worry, who is this information going to? Is it going to go to authorities that are then going to end up deporting me? It has to be done in a sensitive way where we are ensuring that people are keeping their privacy and that we're doing this with more of a public health lens. And ensuring that we're reaching out to as many people as possible, regardless of their status.
The COVID-19 virus has exposed long-standing health and social inequalities. Challenges remain, despite the hope that the vaccines will soon bring an end to the pandemic. Dan Williams, CGTN, Chicago.